This question was about having had surgery in the past, which is a really important thing to kind of touch on, because that's something a lot of us in the TMS community have, we've been through, we've done the surgeries and things, and there's often a question that comes up of like, what does that mean for, doing the mind-body work in hindsight? So the first thing I'll just say about having surgery is, and really any treatments, a lot of us, myself included, I was on a variety of medications, like psychotropic medications for several years when I was younger. And I really had a lot of concerns about how that would affect my mental and emotional well-being and my physical well-being in the long term. And a lot of people ask this about surgeries as well. It's like, have I ruined my opportunity to do mind-body healing by doing Western healing? And the answer is really no, absolutely not. We have lots of flexibility, and the whole, model of mind-body healing is what gives us the agency to understand and trust that immense transformation is possible on the physical level, on the mental and emotional level, and nothing really is going to get in the way of that fully. So there may be structural changes that happen through surgeries or treatments or over time, but that's, again, is part of what we're really trying to embrace, is that having a physical thing that we could see on like an MRI or that you can feel, or you can see, what we want to be really accepting about is that the structural differences in our body are not the problem. They're not necessarily creating the symptoms, and they're not necessarily making the problem permanent. We are supposed to be different. We're supposed to be shaped differently, and we're supposed to have those structural differences without pain or without chronic symptoms going forward. So, it's not to say that it might not, that, area of the body might not need some special care, or, it might be different now than it was before or something like that. But we definitely don't want to think of our past experiences or past choices as creating a wall to our healing process, or changing our trajectory to go forward through this healing work.